I'll talk fast, Mr. Chairman. Mr. Chairman, I rise in support of an amendment that my friend Mr. Lujan and I have introduced to extend the National Health Service Corps program through the year 2022. I'm sure all of you are familiar with this great program. The language is also included in the substitute to the Champion Act offered by Mr. Pallone, which I also support. The language of this amendment, Mr. Chairman, mirrors the bipartisan legislation of H.R. 3862, the National Health Service Corps Strengthening Act of 2017, that I introduced with Mr. Lujan and Mr. Chris Stewart. This program, Mr. Chairman, helps support primary care professionals, including physicians and nurse practitioners, dentists, mental and behavioral health professionals, physician assistants, certified nurse midwives, and dental hygienists who work in underserved areas in urban and rural communities. In exchange for that service, the program helps to alleviate the burden of debt accumulated during the course of their education through scholarship and loan repayment programs. Today, this program has a field strength of more than 10,000 clinicians who provide care to 11 million people, including your constituents. Despite this level of service, it would still take an estimated 20,000 additional providers to meet the existing need in the more than 15,000 federally designated health professional shortage areas across the country. Funding for this program expired September 30th. Our nation's healthcare workforce serving in federally designated health professional shortage areas depend on this funding, and we must do all that we can to reauthorize this program. Just last week, I spoke with representatives from the North Carolina Community Health Center Association and health center leaders from my district in North Carolina. Sadly, one of those counties has an infant mortality rate that is the highest in the country and surpasses many developing countries. The health center in that county is close to hiring an OB/GYN to help address the infant mortality issues, but the professional will only be able to accept the position if this program is extended for at least 5 years. 75% of the counties that I represent in eastern North Carolina are federally designated health professional shortage areas. Numerous health professionals that serve in those counties are part of this program. My constituents, many of whom already lack access to health care, would lose even more access to health professionals if this program goes away or if uncertainty with the program causes them to seek work elsewhere. This amendment, Mr. Chairman, would provide that certainty. It would help grow the program and help deliver care to an estimated 5 million more Americans in shortage areas like those that I referenced. The list of health organizations that support this act stands at 33 groups, and it is growing. Organizations including the Association of Clinicians for the Underserved, the National Association of Rural Health Clinics, the American Academy of Family Physicians, and the American Public Health Association, all of these support this legislation. Many members of this committee have double and triple digit numbers of health professionals serving in their districts under this program. I have many concerns about the Champion Act before us today. I am concerned that it has not gone through regular order, that it takes funding from the important Prevention and Public Health Fund, undermining efforts to prevent serious public health problems before they occur. I am highly concerned that this 2-year reauthorization simply kicks the can down the road, does not provide the certainty that our healthcare workforce needs in underserved areas. I urge my colleagues to vote yes. I yield back.